Good afternoon and welcome back to the Lynn Lowdown. And we are also welcoming back the City of Lynn Public Health Department. Thank you both for coming on the show again.
Thank you for having us.
Thank you.
So we're here today to talk specifically about a Visiting Nurses for Mothers program. I know I probably did not say that correctly, but you know the phrasing better than I do. But before we get into that, would you mind just quickly introducing yourselves and your role within the department, please?
I am Lisa Tobin. I am the city's public health director.
Great.
My name's Kitzia. I'm the lead public health nurse.
Awesome. So Lisa, you've been here before, but Kitzia, you have not. So may I please ask, what does the lead public health nurse do? Like, what is your job description?
Yes, I do a wide range of things, but this past fall, we did like free flu vaccine clinics, and then I do a lot of health education, so doing like presentations, and also sometimes collaborating with the Inspectional Services department and doing like camp regulations. And we actually just launched a blood pressure screening clinic, so doing blood pressure screenings for free for residents. So it's a little bit of everything. It does keep me busy, but it's good. Yes,
it definitely does. And another piece of that is the maternal, child, and family health are also fundamental services provided by the Public Health Department. And I know, Lisa, you wanted to talk a little bit about that.
Yeah, we just wanted to talk about the fact that as a public health department, you know, we're responsible for certain foundational services to provide to residents, and maternal health is one of them. I don't know if you remember, but back in about 2021, there was a lot of concern that maternal mortality rates were going up. And we've recently seen a small decrease in them among all segments of women except for Black women who have given birth. And as a matter of fact, their rates of maternal mortality have gone up. Some people may remember, you know, Tori Bowie, who was an Olympian, 32-year-old Olympian runner. She died. They found her in her apartment from complications of childbirth. And I mean, it just goes to show that regardless of where you fall socioeconomically, like maternal mortality is a serious situation, and something that here in Lynn, where we have so many people of color living in our communities, that we want to make sure everybody has access to the best maternal health that they can get.
Definitely. And one of the ways that you do that is by this program, the Visiting Mothers. And, you know, would you be able to tell us a little bit more kind of about what goes on in that program?
Yes, yeah. So the program is a one-time visit from a public health nurse. And so it does include, it usually starts with a depression screening. So it's the Edinburgh scale, where we're screening for postpartum depression, and we know from the American Psychological Association that about 1 in 7 women that give birth will have symptoms of postpartum depression. And so it's one of the most common complications after giving birth. And so we start with that screening, and then we also will do a keratin screening, which is a parenting like confidence scale. And so a lot of it is parent-led, so we start with trying to understand what concerns they have and having that kind of lead the visit itself. But we do a lot of education, a lot of connecting to resources, because it's not supposed to replace like a medical visit, but it's supposed to encourage parents to feel like they know how to take care of their baby, but also take care of themselves as they're transitioning to bringing a newborn home.
So they might be going, I have this tiny human that's now relying on me for everything. I might want a little bit of extra help in that department. Right?
Exactly. And so we're there to, if we don't know how to answer their questions, like we connect them to somebody who can answer their questions for them. So
I think it's also important to note that this program is not just for first-time moms. You could have your 5th child, and we're going to come out there and visit you if you'd like. So that's one of the really nice things. Like, you know, it's probably nerve-wracking enough when you have your first child, but when you're bringing a 3rd or 4th home child to a home full of kids already, you can definitely use the help then too.
Yeah.
Yeah, and that is a bit unique, because there are a good amount of programs that are for first-time mothers or parents, of course, in general. But this one is also, doesn't matter if you have 1 or 6 kids, you can do it every time. And I want to see if I get this right. It's a collaboration with the North Shore Public Health collaboration that has 8 participants, but this particular program is 15 communities, yes,
Yes.
all along Essex County.
Yes, that's correct. So it started with 5 communities back in 2018. I believe it was Beverly, Gloucester, Hamilton, Newburyport, and Peabody. And then it kind of was put on hold during COVID, and then it was expanded this past year. And it got back up and running, and then that's when Lynn joined, and I believe the count is up to 15 communities now. So, and I think it's even growing because we've gotten other towns are looking into incorporating something like this in their town.
And what would you say are the benefits to having something like this incorporated into a city or a town?
There's, I think, just a ton of benefits. One, because it's free, so it's something that we can provide to everybody, but also, it's to promote maternal and child health. Just thinking back to the statistics that Lisa had mentioned, that it's things that we're seeing. We're seeing the numbers are rising for certain populations, and so we want to make sure we're meeting the needs of our population here in Lynn as well, and but also helping foster that bond between the mother and child, but also helping people be connected to different resources for all the needs that they have, whether it be housing, whether it be food, whether it be transportation. So we're also using this as a way we can connect people and get people in the community to the resources that they need.
Yeah, I would agree with that. We're really making a big stride in going where people are. Instead of constantly having them come to us in City Hall, we're really trying to make a point of getting out there in the community, meeting people where they're at, and introducing them to the whole realm of public health and understanding the resources that we are able to provide to people, and looking through the lens of the social determinants of health to say, how can we help people? How can we make for everyone where they live, work, play better?
And I know that you mentioned a little before the statistics. I may circle back to that in a moment. What were the statistics you were referring to, just for reference?
So maternal mortality rates from the CDC. So, in 2021, it was 32.9%, which was a jump from 2020 of 23.8%. And it's been going down from that high of 32.9%, but it's going down for every category other than Black women.
Oh, okay.
And we just feel, regardless of who it's for, they should be going down for everybody.
Yeah, definitely.
Yeah.
And so this is another way also to check on mothers, check on families, check on people after they bring the newborn home as well. Because you were saying, which is interesting, you might think about, or you mainly think about the needs of the child and what they need, but it's also paramount to think about the parents and how they can adjust to this whole new lifestyle as well, right?
Exactly, yeah. So where, especially given that postpartum, the first couple weeks are very much focused on the infant because they're, can't really do anything for themselves. And so I think sometimes what we see is that the mother's health kind of falls to the wayside, or is not emphasized in these programs as much. And so I think something unique about the mother visiting program is that we do have stuff for the baby. We are giving information about the baby, but we're also also emphasizing mothers and the birthing parent in kind of our initiative and our interventions.
Definitely. And if someone is interested in this program, how would they go about signing up?
Yeah, so there's a couple of ways to do that. So right now we've collaborated with Salem Hospital, so the North Shore Medical Center, and we're getting referrals from their OB department, and then also collaborating with Lynn Community Health Center. Other towns have been doing welcome cards where they send directly to the parents' house, but I don't have enough to do that for Lynn. But so we're doing a collaboration with different offices and hospitals to get referrals that way. But we also have on the website on nsmbp.org there's a referral form as well on the website that people can fill out as well.
Nice. So way for multiple ways for people to get it, and also too, even you were even mentioning before we went on, both of you, how extensively trained the nurses are who do this. I mean, you were mentioning your own experience. It's hours.
Yes, yeah. So it's a lot of different trainings, a lot of cultural competency, a lot of different like trainings on child development, like the different stages and how to support parents, how to support kids, and like how to recognize if kids need more support. So there is a lot of training that beyond just getting that registered nurse license that kind of goes into what we do. So
we're really fortunate in public health to have Kitzia. I feel like since COVID, as all public health departments are trying to get over dealing with the COVID outbreak, the emergency dispensing centers, it's time to pick up all the other little aspects of public health that we haven't had to do in a while. And Kitzia's come on somewhat new and with full of energy and ready to tackle things. And we're really excited to have her. And as you said, like the training to participate in this program goes beyond just being a registered nurse and goes beyond just being a public health nurse. And she's done it happily. So we're thrilled.
Yeah, you can tell how engaged you are. I mean, you can see how into all levels of public health you're in. And I do need to wrap in a moment, but was there anything else that either of you wanted to mention that I hadn't touched upon?
No, I think just also recognizing too, the program is completely free of everything. We don't collect insurance. We don't collect anything like that. It's free for anybody who wants to participate. Really the only requirement is that the newborn that we're talking about is within that first year of life. So any person who's had a baby within the last year, we're more than happy to do a visit for. And we bring a lot of free goodies too. So that we all need diapers, we all need wipes. So it's like we have all of that stuff that we bring with us to the visit, but we also bring like stuff for the mom to relax. Like we'll bring like calming teas and all of these kind of different stuff too. So.
And I would just add that our website is always being updated with new things, new information. We can be reached at Lynn Public Health at lynnma.org anytime somebody needs something. Our community resource room at City Hall is full of free stuff for people to come down, brochures, information, and we're always looking to help people any way we can.
Yes, you definitely do. And who can say no to free stuff, right?
Exactly.
Well, I want to thank you both again so much for coming on to talk about this.
Thank you, Danny.
Thank you.
Thank you. And once again, this has been the Lynn Lowdown. I'm Danny Vittori, and we'll see you next week with more guests.